Hi, I'm Dr. Archana Gupta Mahajan. I'm a pediatric ophthalmologist at Bharti Eye Hospital. So I'd like to talk about pediatric eye problems today. Pediatric eye, there are a variety of problems that can happen in children, and we need to remember that kids are not young adults, so their problems are unique. It's important to remember that there is something called the critical period in children. The eye is still developing, and it keeps developing till 8 to 10 years of age. So it's imperative that as soon as a problem is detected, it has to be treated. So the first eye evaluation in a normal child should be scheduled before he is 3 years of age, and much before if any other problems are detected. For example, if the child is not thriving, if there has been a difficult birth, if there is a family history of any eye problem, if he was premature, if you see a white reflex, or you just feel that your child is not looking properly. What are the problems a child can have? There could be lid problems, as in one eyelid might be lower than the other one eye might look smaller than the other, or there might be some kind of growth on the eye. Any such problem, you need to consult an eye specialist, because these are all treatable. There might be squint. Now what is squint? Squint is a misalignment of the two eyes. This means one eye will look inside, which is called an esotropia, or one eye looks out, which is called an exotropia. It might be looking up and down, or they might be moving constantly, in which it's called an astigmatism. So any time a squint is detected, as soon as possible you must consult a specialist. A squint needs to be treated by glasses, and if required by surgery, as soon as possible. Because otherwise it can result in amblyopia and other problems. Coming to the next thing, what is an amblyopia? Amblyopia is when one eye, although the structure of the eye is normal, that eye becomes weak and doesn't see well because of either not wearing glasses or because of squint in that eye. It can also be because of corneal problems. So amblyopia itself is treatable, but then again at a very early life, less than 8 years of age. So to prevent amblyopia, the child should be treated as soon as possible. Amblyopia is treated by patching and treating of the underlying problem. Refractive errors are very common in children nowadays with the new age of screens and TV, iPad. So they are common in up to 25% of kids. Again, kids need to be checked on time. They need to wear glasses. If your child you feel is not thriving at school, is not doing that well, there are complaints he doesn't look at the blackboard at all, you should come back you should do an eye evaluation. The next thing is a white reflex. If any time you see a white reflex in the child's eye, he needs to be taken to an eye specialist. What can a white reflex be? It could be a cataract. A pediatric cataract is treatable by a simple surgery, and nowadays a lens can be put quite easily. It could be corneal dystrophy, or it could be a corneal scar which happens after a trauma to the eye because of any cause, or it might be by birth. Again, these are treatable by a corneal transplant surgery. Also, the white reflex could be because of retinal tumors. Then this again needs an immediate attention, and retinal tumors also, tumors like retinoblastoma, are very treatable. Glaucoma is another problem that can affect a child. If a child is born with unequal eye sizes, or if you feel the black part of one eye is much larger than the other, or if both are much larger or bluish in color, or there is a family history of glaucoma anywhere, of childhood glaucoma, you should get the child tested. Glaucoma again should be treated as soon as possible. By a simple surgery can be done. The next thing is retina. Retinal problems can affect children as early as at birth as well. The most common problem that can happen is retinopathy of prematurity. So premature kids can have a host of problems. They should be evaluated by an ophthalmologist at birth and frequently thereafter. Retinopathy of prematurity is absolutely treatable. Coloboma might be there. There are vitreopathies. Also, optic nerve disorders can happen. Uveitis can also be common in children. It occurs in association with other systemic problems like joint pains or etc. So, in a nutshell, kids, any eye problem in children should not be neglected. Genetic problems also occur very commonly in the eye. 30% of all genetic problems that have a presentation in the eye. So this is not something to be neglected. We at Bharti Eye Hospital have a dedicated team to handle all kinds of pediatric eye problems. We have a dedicated pediatric ophthalmologist, a retina specialist, oculoplastic surgeon, a glaucoma specialist, cornea specialist, as well as a good cataract team as well. So as soon as any eye problem is detected, please contact an eye doctor as soon as possible.